This is Local Edition. I'm Brad Pomerance in Sacramento today, joined by State Senator Ed Hernandez. He is Chair of Senate Health. He has announced his intention to run for Lieutenant Governor in 2018. I want to speak with you, sir, about what's known as the America Health Care Act. That is the replacement for the Affordable Care Act, Obamacare. It's Trump Care, I guess you can call it. What's your initial take on the plan of the new president?
You mean the act where Donald Trump, the candidate, claimed that everybody would have health insurance, it would be better, we'd be lower price, and that it's the greatest thing in the world? You mean just recently with the CBO reporting that there's going to be 14 million people that are going to lose access to health care. A couple years later, 24 million people. Less money coming to the state of California. Less money coming to covered California for... is that the one you're talking about?
It is.
Yeah, it's not, I think it's horrible.
So it does reduce the deficit by $337 billion over 10 years.
Yeah, but it also is a huge windfall for wealthy individuals at the expense of poor people. It's a reverse Robin Hood.
Yes. There's no doubt that the CBO came out pretty strongly against Trump Care. There's also no doubt that your friends on the Republican side of the aisle, at least in Congress, are pretty virulent when it comes to replacing the Affordable Care Act. And what we know is the sides are so polarized over this that we don't know where this ends. And so my question for you, sir, is what does California do in the wake of this tremendous uncertainty? Because look, we can say a lot of things about the Affordable Care Act, but what I have learned is that California, and of all places Kentucky, are two states where the Affordable Care Act has done pretty well.
Right.
I don't know why Kentucky has done so well with the Affordable Care Act, but they have. Exchanges, Medicaid expansion, it's been fairly successful here.
So what we have to do, number one, is to defend and make sure that the federal dollars that are coming to California stay. Because if we lose any federal dollar, we cannot backfill it in our general fund.
And let's talk more about that. I'm glad you brought it up, because there are two pockets of federal dollars. There's the Medicaid expansion and the subsidies that go to those that are in covered California. As I understand it, the covered California subsidies are about $5 billion, Medicaid about $15 billion. Could we backfill the covered California subsidies, $5 billion?
Well, it would be difficult.
Okay.
I mean, if we did, keep in mind that over 90% of the subsidies that the consumer gets from covered California comes from that federal dollar.
Right.
And we have a tough budget cycle that we got to go through. And
the governor
predicts there's going to be a recession, which we can agree or disagree.
Right.
But at the end of the day, if you think about, let's say we have a windfall of money that happens to come in the state, over 50% of that's going to go through K through 12, through the initiative
Prop
process.
98.
And then everyone else is going to need a little bit of a conversation to make sure that they get there for a portion. So it's going to be very difficult. So I think the first thing we have to do is defend and make sure that we get those federal dollars, and then let's have a conversation after
Here's
that.
what's so interesting about the conversation. The Medicaid expansion raises the ire of those Republicans that are on the right side of the political spectrum. But those Republicans that are more towards the center, especially governors from, for example, Nevada, Brian Sandoval, John Kasich from Ohio, they feel pretty good about the expansion because the expansion has been successful in those states. And so I wonder, how does the Republican support by governors play into the conversation about the expansion? Because that's what the Republicans on the right really want the expansion eliminated, but the centrist Republicans don't.
So you're talking about Kentucky, for example.
Right, another one, right.
Louisiana, for example. Their uninsured rate has dropped significantly. The amount of federal dollars that come in to help offset that, those individuals now have access to care, they're healthier, they're more productive, they're going to be working, they're productive citizens. They understand the importance of this federal dollar. I know the extreme right wants to just eliminate it completely, but we can't go there. That's just inhumane.
And what's
it's inhumane.
What's so interesting about Trump Care is that there's been an analysis done, and Trump voters, as I read the analysis, would be most severely impacted to the detriment, as opposed to Clinton voters. In the blue states, some would argue Trump Care is beneficial because the blue states are wealthier. and they'd get the benefit of the tax cuts. It's the red states where these folks really need Obamacare, and they're going to be hurt the most.
So let's look at California in particular. Let's look at the Central Valley that
Right.
has the greatest need, the highest incidence of disease process. Kevin McCarthy,
Right.
the Republican leader who is adamantly opposed to the Obamacare or Affordable Care Act and wants to eliminate it, if this bill in its current form goes through, it will absolutely hurt his constituency the most.
Kern County.
Kern County that has over 50% of its population on Medi-Cal. Now tell me, how insane is that?
It's quite remarkable, but we are seeing moderate Republicans in the Congress peeling off, even in the Senate. I mean, look, as we speak today, I don't know what's going to happen with the current bill. Maybe even before this airs, it will be revised. I do want to talk about a plan that's being floated by one of your colleagues in the Senate, Ricardo Lara. And that is, and I hate to use this phrase because people think it means one thing and it doesn't, single payer.
Right.
Single payer, as I understand it, it's not socialized medicine. The doctors are not going to become government employees. It's simply who is handling the transfer of funds. Before you tell us what you think of single payer, tell us what the plan does or means. Or
So it hasn't been analyzed. We don't have language.
I understand.
So
I understand.
I can just go by what previous bills have
Fair
gone
enough.
forward. So saying that, my biggest question.
Okay.
Well, first of all, we should have a conversation about everybody having access to insurance.
Right.
I would totally agree with that. But the first question I would have is, how are we going to pay for this?
Yeah, and so let's talk about that. Because
How are we gonna
under
pay for this?
Senator Lara's plan, known as Medicare for All, it would be a mechanism whereby residents would pay into a state agency that functions as the insurance company. How do we pay for that?
Right.
The agency pays the doctors and the hospitals. The government's not taking over government care. This is not, I don't know, socialized medicine of Europe. It's more Canadian-like. But even some feel as if you say Canada, that's problematic. So what we're looking at in terms of pay, how do we do this? I mean, there are discussions about pooling California's Medicaid dollars, Medicare dollars, maybe taxing employees, taxing employers. The employers wouldn't be paying health insurance, so that money would be saved and would go into this fund. It looks like 4% on employees, 7% on employers.
So let's talk exactly what you just mentioned. First of all, to get federal Medicaid, federal Medicare money, you're going to need a waiver.
Right.
And in order to get a waiver, you have to get permission from this president and this Congress and this U.S. Senate.
Well, he's about states' rights.
Well, but I don't know if he's really in the mood to help California much. So that's one obstacle. If we were to take the other dollar, now you're going to shift the dollar that the companies are paying, and now does that mean the state's going to, so I don't know the mechanism, is the state going to tax the companies, is the state going to tax the consumer?
Deductions,
But
deductions.
But I also think we need to have a conversation. The absolute most important thing is, how are you going to control healthcare costs? Doesn't matter what system we have, who's paying, but we have to have a system that'll look at controlling healthcare costs. And the Affordable Care Act does a lot of it, with the exception of one industry that has gone unchecked.
Drugs.
The pharmaceutical drug industry.
Yeah. And when you come back, I want to talk about that because you've been pushing drugs transparency bills for quite some time. I want to go there with you if it's possible. And let's continue this conversation. Obviously, as Chair of Senate Health, you'll be focused on this like a laser beam. His name is Ed Hernandez. He is a candidate for Lieutenant Governor of the state of California. He is currently a member of the California State Senate. My name is Brad Pomerance. We're so glad you joined us on Local Edition from Sacramento.